Hi, my name is Sturtz. I'm a 7th semester nursing student at Lincoln University. Today's date is September 20th, 2017, and the time is approximately 10:45 in the morning. So today I am going to perform an NG insertion, meds per tube, and NG removal on my patient. So I have verified my doctor's orders for the need to place an NG tube. So I've gathered all of my supplies. I've gone into my patient's room, I've provided my patient with privacy, I've performed hand hygiene, I've introduced myself to my patient, identified my patient using 2 patient identifiers, I've explained the procedure to my patient, I've answered any questions that he may have, and we have also identified a means of communication for throughout the procedure. I have also raised my patient into a comfortable working height, and I've also have him up in high Fowler's position. So now I'm going to go ahead and begin. Open my kit. So at this point I want to inspect my tubing to make sure that there's nothing wrong with it, make sure it's intact. So I'll go ahead and measure my patient, and to do that I'll measure from the tip of the nose to the ear and down to the xiphoid process, which is right about there. So in order to do that I'm going to go ahead and mark it so that I know how far to insert. I'm going to go ahead and lubricate about the first 4 inches to help me with insertion. I have informed my patient that I'm getting ready to begin and that during this I'm going to have him take sips of water while we are inserting. I've also checked my nose to see which nair is the biggest, and now I can go ahead and insert. So I have reached my tape, so now I'll go ahead and tape them on. I'm going to go ahead and do a couple more pieces of tape just to secure the tubing. In real life, I would not go over my patient's nostrils, but due to the mannequin, it is hard to tape. So now that it is in, I'm going to first check the back of my mouth to assess that it's in, which I can see it. So the next thing I want to do is I want to check the placement of my tubing. So in order to do that, I'll go ahead and I can do it in 3 ways. I can check pH level by extracting gastric content, but then I would have to replace it back into my patient. I can check by x-ray, which is the way that we usually want to do it by. But the last way that the way I am going to perform today is to do it by instilling about 10 mLs of air and listening for a whooshing sound. So I'll go ahead and hook it up. Which I heard the whooshing sound, so I know that it is in the stomach. I'll go ahead and clamp it off just to make sure that nothing comes out and secure it. I also then want to attach this to my patient's gown and give it some slack so that it does not get pulled out or it's got a little bit of leeway. And this tape does not like to stick. So we're going to try another piece. So at this point, I'm going to go ahead and remove my gloves, perform hand hygiene. I will lower my patient back down into a low position, make sure that the call light is within reach, and go ahead and document my findings document how well the patient tolerated the procedure, and document how if any secretions came out and the size of the NG tube. And he does not like this tape. So now, I now have orders to go ahead and give my patient medications through his NG tube. So to begin, I have verified my orders for the need for medication through tube. I have gone ahead and gathered my supplies, gathered my medication, and in the hospital setting, I would go ahead and bring the medication into the patient's room, verify that he actually wants it, and then I would go ahead and crush up the pills. But I've gone ahead and crushed up the pills in my patient's room. But before I go ahead and give my meds, because this tape keeps falling off, I'm going to tape it again. I'm bound to determine not to let it fall out. Okay, so to begin, I'm going to go ahead and perform hand hygienes. I've already identified my patient using 2 patient identifiers. I have gone through my medication checks and verified that he does want all the medications, and my medications are crushed up. So to begin, I'm going to go ahead and put on some clean gloves. And the first thing I want to do is I want to flush out my NG tube with just water, about 10 mLs. Go ahead and clamp it off. Flush it. And secure it one more time while I go ahead and draw up my medications. So I'm going to use this syringe for my water for each flush in between. And I want to do about 10. Go ahead and draw up all my medication. I'm going to try to get rid of as much air out of it as I can. So I'll go ahead and begin. Clamp it, insert the tubes, push the medication, clamp it again, and do my flush. I'll go ahead and reinsert this and go ahead and get my next medication. So once again, I'll go ahead and draw up another 10 mLs of water for my flush and my next medication. Making sure to draw it all up. Once again, pushing out the air to decrease the amount of air that is instilled. Unclamp it, go ahead and insert my medication and push it. Clamp it again, and then time for my flush. Go ahead and flush the flush the water. Clamp it and lock it off. And then we have one more medication that we're going to give. So once again, another 10 mLs of water and my last medication. Go ahead and unclamp it, put my medication in, take that out, and we'll flush it one more time. And we'll shut it off again. So at this point, I've given my patient all of my medications. So I will go ahead and ask my patient if there's anything else that he may need at this time, lower him back down, put the coli within reach, and then I will go out, document how well the patient tolerated the meds per tube and if there were any difficulties, complications that may have occurred. And like I said, he had already said yes to taking the medication. So I'll go ahead and perform hand hygiene. And at this point now, I received orders from my physician to go ahead and remove my patient's NG tube. So I've once again gone into my patient's room, identified my patient using 2 patient identifiers, identified myself. I've explained the procedure to my patient and told him how we would be doing it. I provided patient with privacy and performed hand hygiene. So I'm going to go ahead and begin to take out his NG tube. So I've explained to him that as I'm taking out his NG tube, I am first going to flush it with water again to make sure that there is nothing in it. And then he will take a deep breath, and as he's slowly exhaling, I will take his NG tube out. So I'm going to go ahead and flush his line. And before I would remove his NG tube, I would want to make sure that the medication feedings have been stopped for 30 minutes. So now I'm going to go ahead and remove it. So I've informed him to take a deep breath and to slowly exhale, and I'm pulling it out. I want to inspect the tip to make sure that it is all there, which it is. So I'm going to go ahead and throw that away. Clean him up some. Take away my dirty linens and throw those in the dirty linens. At this point, I would want to lower my patient down and back to low position, put my coli in reach, make sure that there was no other needs that he needed. I would perform hand hygiene. I would go out, document how well my patient tolerated the procedure, the date and time, the size of the NG that was removed, if there were any complications, and in secretions if they came out.